his interaction with chief ministers of states in India's battle against COVID-19. In fact, in India's battle against the fresh surge in cases of COVID-19. So what is it that the Prime Minister emphasized on? What were the do's and don'ts? Where does India stand now as far as the pandemic is concerned? Himani Channa, who tracks health for ThePrint, has been covering COVID for ThePrint, is with us in this episode of Government Matters. Please start sending in your questions. Himani, so first let's talk about the numbers a little bit to give a sense of the gravity of the situation and how things look in India over the last few days.
Okay, so of course the trigger has come from the continuous increase in the number of cases. In fact, yesterday India has reported 28,000 fresh cases, which is the highest number for 2021. Earlier on 29th of January, we reported 18,000, which was the earlier highest. So now we have reported 28,000.
Right.
And in fact, in today's press conference, Health Secretary has said that the cases are increasing 43% week on week.
So that's significant.
That's significant. And even deaths are increasing 37% week on week.
Right.
So today Prime Minister Narendra Modi has also said that, we need to curb the second peak. And he has also laid out, several points that what the states need to figure out and how, should keep a check on all these points.
So can we talk a little bit about what he has told the states to do? Because there are certain states where the concern is more, and he's also talked about how we shouldn't get complacent considering, handling the last time.
So first, of course, I will like to add that which are the states. So this is the data. 83% of new cases are coming from Maharashtra, Punjab, Karnataka, Gujarat, Tamil Nadu and Kerala. Of course, we have been hearing this since last few weeks that Maharashtra is the state where the case burden is very high. Out of the 83% of new cases, 61% constitutes of Maharashtra's cases. And the test positivity rate, this means that out of the total tests that are conducted, 16% of them come to be positive, which is a very high test positivity rate. So Maharashtra is one core state where the hike in the cases is should be noted more. And of course, he has taken the name of these states as well in the virtual press briefing that he had with the chief ministers. And like you said in the beginning, test, track and treat is what he started with this golden rule. Followed by, he also noted that some of the states are unable to manage the carelessness regarding the wearing of masks behavior, the COVID inappropriate behavior that has been creeping in now with the people as more of the opening has taken place for the economy. Followed by the fall in number of RT-PCR tests the states are doing. And then he also noted a point where he said that, earlier in last year, we noted that most of the cases were in the tier 1 cities and the phenomena was mostly related to the urban areas where cases were more. But he said that now the cases are nearing to the tier 2 and tier 3 cities, and now the need to protect villages is much more because the infrastructure in the villages may be overwhelmed and the villages are not ready to take this load. And he said that we need to develop a mechanism for ambulances and the referral systems where if a case comes, how that person should be shifted to the nearby hospital and all of that. So these are the points that he has highlighted.
Okay. So Radhika Ghosh wants to know, the PM spoke about vaccine wastage. Why isn't the government including the private sector in the vaccination drive? When can we expect that to happen? So I think now everybody is asking why the government is not opening up the vaccination program.
Right. So in fact, today PM said that we need to scale up our vaccination drive. He said that we need to, finish this fight, otherwise this vaccination drive is going to take year and year. He said 2 से 3 साल, फिर उससे भी ज़्यादा समय लग सकता है अगर हम इसी स्पीड पे चलते रहेंगे. So he has clearly highlighted the need to scale up the vaccination. Of course he hasn't said anything about the more of the private partnerships, but he has clearly said that we need to add more of the public and private centers. Now the question that remains is that why are we not giving private sector the access to the vaccines? So why are we not doling out the vaccines in the market space? That remains a question because the expiry date of the vaccines are also they are also nearing. And in fact till last year we were hearing Adar Poonawala from Serum Institute of India saying that the price of ₹1,000 will be is what he expects when he will roll out the vaccines in the private market. But as we understand from the government sources, they say that vaccines are still under the restricted emergency use.
So the prices are unlikely to go up, you're saying, even if it's opened up in the private sector, to the private sector?
So I'm not sure if government is planning to open it up because of the restricted emergency use tag.
Right.
So first, if government plans, these vaccines will again go back to CDSCO for removal of this tag.
Got it.
Or
Okay.
to another procedure from CDSCO will be followed to approve this and then bring them to the market, and then the phase 4 trial will be done to understand if the whatever claims that have been done on the vaccines, are they all true. The marketing authorization process that will be carried on after that.
Right. Okay. Hitesh Nautiyal, what is the status of the other vaccines? What are your views on herd immunity?
So herd immunity, of course, various experts say that particularly for COVID, we don't know at what level we would be able to achieve herd immunity, but it will be somewhere between 60 to 80%. Herd immunity, so we need to understand that by what percentage, because the movement of our vaccination drive is not very good as of now. It's quite slow. And the other vaccines, of course, that remain pending for the approval. Of course, we have Russia's Sputnik vaccine that Dr. Reddy is doing the phase 3 trial. Then we have Zydus Cadilla's vaccine, which is also in the phase 3 trial. And Pankaj Patel has in fact told us that they are likely to present the data to DCGI by May this year. But they were concerned that the number of cases now are going down, so the participants for the phase 3 trial will also be lesser.
Right. Okay.
So these were the problems, and of course Pfizer is right now not coming. We are not sure about Moderna as well. India may produce J&J, but I don't think that it's coming here for the approval. So we have 2-3 options in hand, and in fact one of the senior government officials said that we need to go back to Pfizer and Moderna and try to bring them here, and find a middle way to basically start a negotiation with them, because we need more vaccines.
Right. Okay, Apurva, does the expansion of the vaccination drive come under the state's purview or under the centers? If not, then how come Ludhiana extended it? And if it does, then why are other states not doing the same thing?
So the supply for the vaccines of course come from the center to the states, but today also the health secretary has said there is no shortage of vaccines in the country at all. And also we understand that vaccines are being manufactured by all these players on a regular basis. Just that the concern is that the expiry date, they should be used as per the expiry date, because Serum in fact started the production last year.
Right.
So probably there is no concerns related to the availability of the vaccines, but it is the center which supplies the states with the vaccines as and when it is required and how they put in the request.
Right. So, but I think the question is that if Ludhiana has taken this step of expanding the definition of those who can take the vaccine now, and it's a very welcome move, other states should also perhaps follow suit, particularly states like Maharashtra, which are witnessing such a surge.
So today PM Modi has said that we need to strategize something. Okay. And experts also say that government needs to form a strategy where the cases are more, maybe the vaccination should be more there, or the vaccination should be accelerated in those states. But I don't think that definition could be extended beyond what center has advised them to do.
Right. So
Yes,
so that's unlikely to happen.
Right.
Okay. This is Debajyoti Bhattacharjee. Why is Sputnik V not yet approved for emergency use? Is the government fearing lack of adequate vaccine supplies for opening up the vaccination process?
No, because Sputnik is also following the same process that was followed by Serum Institute or for Covaxin. So Sputnik V has to submit the phase 3 data, and I think they have done it already, but the expert panel has asked for some more data on immunogenicity. So I think that is pending. So whenever the next SEC will sit, we might get a good news as well.
Right.
So the trials are already in the phase 3, the data is asked for, and this is something that we were hearing when the Serum Institute's AstraZeneca vaccine was also waiting for the approval. The same process is being followed here.
Right. Okay. Vival has 2 related questions. Will there be interstate travel ban, and are we looking for another round, or are we looking at another round of lockdown?
So nothing has been hinted so far, and I don't think that the situation is that grave so that we keep, we start talking about the lockdowns. But I'm sure that some restrictions could come up. Because PM has also hinted that we need to curb the second peak. He used the word second peak. This means that some restrictions are going to come up again, considering the COVID appropriate behavior negligences
that we've been witnessing. Right. Okay, Akriti and Aryan again have related questions. Akriti wants to know whether there's vaccine wastage in India, and Aryan is asking whether there is a wastage of vaccine in states like Telangana, Andhra Pradesh and Uttar Pradesh.
Yeah, so these are the 3 states that PM has named in his speech. He said that vaccine wastage is more than 10% in each of these states. He said that we need to curb it. He said कि जितना हमारा vaccine wastage हो रहा है, this means that we are eating onto someone else's right to get that vaccine, which is very true. He said that government needs to train the state officials and the district officials so as we can reduce this vaccine wastage. Apart from that, he also highlighted the expiry thing that we are talking about, because we are hearing that some of the vaccine manufactured by Serum has the expiry date for April. He said that while manufacturing is the continuous process, we must also keep a tab on whatever the older stock is there, we use that first. So of course vaccine wastage is one of the important areas we need to consider.
Okay, Anil Girotra, some chief ministers by not participating in the meeting have sent a wrong message, and there is a related question from Rajesh. What is your view on West Bengal Chief Minister Mamata Banerjee and Chhattisgarh Chief Minister Bhupesh Baghel not attending the crucial discussion? But looking at it as a larger issue, Himani, is there, there was a time when there was a lot of bitterness between the centre and states, particularly between West Bengal and the centre. Does that continue, or are we seeing more cooperation, because this is really a demon everybody has to battle together?
Yes, I think for COVID at least, I'm not talking in the political terms, but of course in COVID I think there is a lot more cooperation between the states. And in fact today PM has said that all states need to do a bit more cooperation in terms of sharing their COVID experiences.
Right.
Because some states which are now seeing a spurt in the cases, for example Kerala was not seeing this spurt earlier. It was one of the states that was hailed for its COVID strategy.
Managed.
So he said that experiences should be shared, and he also said that information of people traveling, for instance the international travelers that are coming into India, they are testing and tracing. The states should share that information as well. He also said that states should share the information about the circulation of mutants in their particular states with the other states, because we still, there is a question over the characteristics of the mutants. We don't know that how they will behave.
Right.
So hearing to all these things, we understand that states are cooperating with each other, and center is also, is also controlling them.
Right. Okay. Ashwin Shankar, how long does it take for immunity to develop after taking the first and the second shot? And then the second part of his question is, till when can we expect the Johnson & Johnson COVID-19 vaccine in India? You've already spoken about the J&J one, so the first part of the question.
So, for immunity, so the second dose is taken after the 28-29 days of taking the shot, and it can be taken up to the 42nd day, I think. So, after taking both of your shots, the immunity will come, but still it is always said that you have to wear a mask, you have to follow the social distancing, and we are also hearing that ICMR has started a survey and also studying the effect of these vaccines and how long the immunity is with us. So I think that is the reason, because these vaccines are new and a lot more we have to know about them. These studies and observations are still on. So there is no perfect answer for this as of now. I think researchers and scientists are looking for those answers.
Right. So
J&J vaccine, for which he asked. So the company, we tried to understand this from the company as well. I personally reached out to the company officially, but they said that they cannot comment at this moment. And according to sources, their problem is also the bridging studies that are required in India. If bridging studies are required, and even if today Johnson & Johnson wants to come in India, they will take at least 4 to 6 months to complete those studies.
Right, okay. So Vrideep Sengupta, do you think the second phase is less deadly as compared to the first one, or is this just the silence before the storm?
this could be just the silence before the storm. If we don't understand that COVID is still here, it hasn't gone anywhere, and if we don't start, behaving accordingly right now from today itself. So we cannot say, because it is only about our behavior. If the country starts again,
lapsing into carelessness, right?
Yeah. So the cases will go much, much above than what we have seen already. But in case we start behaving properly from today itself, it will come under control any day.
Right.
Because vaccination is also going on. We must consider that point as well.
Right. Okay. Vival, how can the PM say that COVID has not spread to villages despite mass labor migrations last year? So I think the question is about we saw images of migrant laborers walking back to their villages from urban centers. So has it not spread to rural areas?
It was reported that the COVID was limited, and thankfully it was not spread to the rural areas. So we believe that it was true, because the cases were not coming as high as they were in the urban in the urban areas. But of course, his concern is very legitimate, that in case the COVID goes to those areas, the testing, tracing, tracking, treatment, everything will be very difficult.
Right. Okay, so we can't say this enough. COVID is not yet over. Everybody has to follow COVID appropriate behavior, COVID protocol. The PM also emphasizing on that in his meeting, in his video conference meeting with state chief ministers, and the fact that we can't let our guards down yet. Thank you, Himani, for being with us in Government Matters. Thank you for sending in your questions. Do keep subscribing to our YouTube channel. You can follow us on Twitter, and you can like our Facebook page.